Hi, I'm Dr. Pallavi Prathivadi and I'm GP Registrar here at Berwick Healthcare. We're taking a few minutes today to make this small video about a couple of issues that I've been seeing heaps of in my clinical practice. And the big one is contraception. So I think there's a lot of rumors and myths that go around about contraceptive options. And it's not a one size fits all. Each woman needs to have a really good contraception that works for her if what she needs is birth control. And there are contraception that we definitely recommend, like condoms, because it's basically the only thing that we have around that will reduce the risk of sexually transmitted infections, also known as STIs. However, condoms in itself are not great as a contraceptive. And we kind of quote figures of maybe somewhere between 75 and 85% effective, which means that they do actually carry a risk of possible pregnancy. The good news is we have heaps of contraceptive options that might be a bit better. You might have heard of the really common ones, the contraceptive pill, whether you're talking about the mini pill that has progesterone only, or the combined pill that has estrogen and progesterone. And both of them are somewhere between 90 and 95% effective if you take it properly. If you want a really solid contraceptive that is, if you're really not in a place to get pregnant right now, you are sexually active and you want something that's very reliable, the options that you've probably got are the Implanon, which is a little rod with progesterone in it, and it sits just under the skin in the upper arm. You can't see it, but you can feel it, and someone else can feel it if you point it out to them. But it sits in your arm for about 3 years, and it's close to 99.9% effective. Your other options are Mirena, which is a little device that sits inside the uterus, and is probably also about 99.9% effective, and the Depo injections, which are also progesterone only, and it's an injection that we give you every 3 months into the muscle in your upper arm. Certainly they all come with some risks and side effects, but they're really good options if you want something as reliable as possible. Even if you're using those though, we would still recommend them that you use them with condoms to protect against infection. The second part of this video is, even if you're not sexually active or needing contraception right now, all of these things that I've been talking about have other benefits. Some of them can help with acne and improve skin, and the big benefit is that they can often improve periods. Now, historically, women were having periods a lot later. On average now, we're talking about probably about 12 years of age as first period. And back in the days, women were having more babies and they were breastfeeding for longer. And during that time, they weren't having periods. Also, menopause used to happen a lot earlier. Compared to now, we're talking menopause on average of maybe 50 to 55 years. And women are having maybe 2 children, breastfeeding for an average 6 months. We're having way more periods now. And it may not come with any added benefit. In fact, it might just be a little bit of a burden. So or at least I have been seeing heaps of young girls who are in high school, in university, or working and saying, look, these periods, can I do anything about them? Do I need to have a period every month? And the answer is no, you don't really. And a lot of the contraceptive options I was talking about before can either stop your periods or help reduce the amount of bleeding or how often they're happening, and give you a really good benefit in terms of, holistic care and going about your day, enjoying life without that extra burden of periods all the time. So what I would suggest is come and talk to one of us about contraception, periods, all of these women's health problems. If it's something that's relevant to you, we would love to talk to you about finding a really good contraceptive that works for you. At the same time, we'll check that you are up to date with your mammograms if you need them, pap smears, which all women should be getting over the age of 25 now, or if you're a little bit older than that, we check that you are on the previous schedule. But we're really happy to talk to you.